The Affordable Care Act has run into a lot of resistance here. No Medicaid expansion. At the same time, things are about to change. The public exchange, the health care marketplace goes online in just 1 week from today, I believe. And that will bring some changes. It will tear down some barriers for getting health insurance. For example, you can no longer be denied coverage for a pre-existing condition. There will be no annual or lifetime caps on coverage. So it opens the doors. At the same time, in Oklahoma, in the context of this state, we have some of the most abysmal health outcomes in the nation, whether it's obesity or cancer or heart disease or even dental care. Do you think now the Affordable Care Act will make a difference in improving the overall health of Oklahomans?
David, thank you very much for the question. And also let me start by thanking Oklahoma Watch for sponsoring this exchange of ideas and information. I think this is an incredibly important topic for our state and certainly for individuals and families who will be directly impacted by the Affordable Care Act. An Affordable Care Act, it goes by several different names. I'll just use the ACA and Affordable Care Act if that's okay with you. There is no doubt that access to quality, affordable health care is good. It's good for Oklahomans. It's good for people across our country. I think that there is some hope that some of the changes that will be made, like around preventive care and other services, actually will lead to positive health outcomes. I think there also is a measure of concern about what those outcomes may be. Will they be as robust as they need to be as our country invests billions of dollars in this enterprise? I'll give you one very quick example of my concern, because I see this every single day where I work. My office is actually located right in the heart of kind of a medical community. And in that medical community, we have the highest concentration of healthcare in the entire state of Oklahoma. We have more hospital beds, we have more physicians, we have more nurses, we have various schools of training for healthcare professionals, and that care is actually free. So it goes sliding scale fee, it goes all the way down to zero. And I can walk 2 blocks from that high concentration of healthcare and see the worst health outcomes in the entire state. So that's a huge concern for me when I think about kind of a magic bullet or a single issue that may address these health outcomes. Sounded like such a simple question, but it's really a very complex answer. And I don't believe that it's just about access to that health care. I think that access to that true access, competently delivered health care is very important. Are we providing that in the right languages? Are we doing that in a culturally acceptable manner? It's not an easy task to do that. It's an important element. Making sure that people actually will avail themselves of those services if they're offered free of charge or for a nominal fee. So it becomes very complicated. But there is no doubt in my mind that having access, kind of that triple aim, high quality, low cost, accessible health care that's focused on improving health outcomes, that's good for the people of Oklahoma. Will we get that with the ACA? I think that's to be determined.
Andrew, same question for you, but a point I guess I would take from what Terry says is that critics of Obamacare, and we can refer to it as Obamacare, so many people do, will say, a lot of people's health depends so much on personal choice. You choose to smoke, you're overweight, you engage in risky behavior. So how is a program like this healthcare law going to overcome that? Will it make a difference in people's health in Oklahoma?
Well, it's great to be here tonight. Thank you for putting this on. This is a complex law, and it's great to be able for us, although I think Terry and I are a little uncomfortable with being considered experts. I don't know if we're considered experts. There's clearly a lot about the law that I don't know, and so I'm glad that you can have the email option of things we may not know the answer to the question to. I think that we see it at Variety Care, which is a community health center, and we're the largest community health center in the state. About 40% of our patients are uninsured. Interestingly, many of those adult uninsured work. They just don't have insurance that's provided at their employer because of cost. And so we definitely see those who are able to avail themselves on a sliding fee to get access to primary care on a regular basis, we are able to make much farther inroads on issues like wellness and making impacts on their chronic conditions because they have access to a doctor who can help them manage that. The opposite of that would be a case I had a referral actually that came through me recently from a former colleague in the legislature who had a constituent who was uninsured and has a health condition that's worsening. So I talked to the constituent's wife on the phone, and he had a condition that looks like, I'm no physician, but probably may have to go outside of the primary care sector that we work in and see specialty care. And I said to the wife, how long has it been since he's been to a doctor? She said, oh, it's been several years because he doesn't have any insurance. And without going into specifics, it seems like perhaps his condition is one that if it were caught earlier, could have been better. And so that's a case of because of the monetary barrier that his family had to good access to quality care, perhaps his condition is going to be worse and may end up where a lot of our uninsured have ended up in years up until now with the passage of this law at OU, at our other hospital systems, having to be admitted for more expensive care, and which gets shifted onto the taxpayer. So I think that that's sort of an example of the old system. My hope is that the ACA will address a lot of those issues.